I think this is an evolving field. I think the benefits for surgeons are few. First and foremost, I think, is the ability to put us in an environment where we and our patients are exposed to less radiation. Ionizing radiation, you can't see it, smell it, or taste it, but it affects us and can have profound effects, including cancer. So if we can decrease that radiation exposure, which robotics gives us the ability to do, that's going to translate into significant benefit. Secondly, the issue is what we do for our patients. So if we're able to improve our accuracy and precision, help our patients get better faster, then that's a significant improvement in our lifestyle, but also in the lifestyles of our patients. I think that all patients are potentially candidates for robotic surgery. Any patient that we would consider doing spinal surgery on is a potential candidate. We used to think patients who were very morbidly obese, for instance, might not be the proper candidate. In fact, in those patients, this is actually a significant improvement because we can actually navigate and put in instrumentation into spines, even in very large patients with sub-millimeter accuracy. So there really isn't a patient that's not a candidate. Some patients fear robots, but I tell them that they're asleep during surgery and they have nothing to fear. I think that we're really at a nexus in our field of surgery where we've got advancements in imaging, in surgery, and then we've got this marriage of surgery, imaging, and robotics. That's really the opening of the door. I would conceive of a time in the not too distant future where we're able to not just put screws in, that's every day, but be able to navigate putting devices within the vertebral space and to do bone work, to do osteotomies, laminectomies, discectomies, so do soft tissue and bony work with the usage of a robot. If you look at the history of spinal surgery and neurosurgery, we've been a very technologically driven specialty. And while the adoption of that technology takes time, the forward motion is that we incrementally will adopt technology and improvements that help with the outcomes in our patients. I think robotics seems like it's a far fetch at this point, but the reality is I think it's something that is easily embraced by practicing surgeons and something that will ultimately transform into becoming really the state of the art of what we do. There's no doubt that there's a cost associated with all technology, but as is often the case, as adoption increases, the price of that technology starts to fall. So early adopters and innovators often are paying that price for the technology as they acquire and use it. Over time, that price will go down, and as we prove the benefits, the price becomes absorbed. So right now we're at that phase where we're gathering evidence. How accurate are we? How much quicker are we doing the operations? How much better are the patients doing? What we found in our own experience at Johns Hopkins is in a series of patients that we recently completed is that the time of the procedure is shortening. We're able to discharge patients sooner from the hospital, which is better for patients, and it represents a significant cost savings. So I think over time, what we'll probably see is that this technology will be enabling us to save significant money on the back end for operative time, length of stay in the hospital. All that remains to be proven, but we're moving in that direction right now. I think the millennials have grown up in a different era than I did. They're very facile with their mobile devices, gaming, and that ability to grasp technology and to harness technology to, in this case, the benefit of the patient, not just winning a video game, I think it serves them very well. The millennials bring with them that no biases. So older surgeons will be biased about the way they've done things. Millennials who are exposed to this technology are able to pick this up in very short order. It's actually easier for me now to train a millennial to go through a procedure with the assistance of a robot than it is to train them to do it the old way. And the reality is that because of work hour regulations and whatnot, we have much less time with trainees to teach them what we do. So there has to be some ability to get them through their training and to make them good surgeons. Then the reality is that will be helped with the usage of technology. So it's a good thing that they know how to do what they do, because it's making my job easier.